I'm Dr. Janette Nesheiwat. Joel Carver has the evening off. Voter turnout in record numbers made a big impact. Well, just a few weeks ago, we turned our clocks back and gained an hour of sleep, giving us much needed extra time. In today's Health Minute, Melissa Long explains why paying attention to our body clock is so important. Many people believe diet and exercise are the cornerstone to a healthy lifestyle. But here at Cross Fitness, they add an extra element, the power of prayer. The University of Rochester Medical Center is using blue dye to treat spinal cord injuries. So far, it has worked on rats.
Right now we are heading to the village of Lagan. There is no medical help there, no doctors. The people have been affected by the earthquake. They have lots of injuries, infections, and they have no one to care for them. So we're bringing this huge busload of supplies, and we've got a team of doctors and nurses, and we're heading out there. We're going to spend until it gets dark, until we fall to the floor. We're going to take care of as many people as we can.
You know, we've all made them, resolutions to make positive changes in our lifestyles, including starting a solid workout program. But too often, those intentions get put on the back burner, even though we know regular exercise is an integral part of maintaining good health. Hello, I'm Dr. Janette Nesheiwat. I'm here at the Go Red for Women Health Heart Luncheon. We have a big turnout today. Many women from across the state are here to learn how to live a healthy lifestyle. Well, bargain hunting is something you do in a department store or supermarket, not a hospital, right? Well, Elizabeth Cohen begs to differ.
There's still a great need for food, water, and antibiotics. People, even once they are getting better, they have no place to go home to, and that's when infection sets in.
Did you know 1 out of 5 people will develop a mental disorder in the course of a year? Up next, how one Northwest Arkansas mental health provider is tackling this startling statistic.
We're going to turn to our medical expert, Dr. Janette Nesheiwat, for more on that. Hi, Dr. J.
Hi, Carolyn and Chef Jonathan. You know, ginger is an excellent remedy. Ginger can relieve motion sickness for travelers, morning sickness for expectant moms, inflammation for arthritis sufferers, and it's effective in treating nausea and general stomach upset. In fact, some oncologists are now recommending ginger to their chemotherapy patients because the natural properties of ginger do not interact with other medications of cancer. This is also very cool. Some recent studies indicate ginger may actually inhibit the growth of human colorectal cancer cells. Now, Dr. Thomas, it's that time of the year. We want to get fit, we want to get in shape, we just want to improve our lifestyles. Tell me, what is it that works for you?
Have had no medical care. Some of them are victims of the earthquake. They have broken hips, they have infections, some of them are giving birth out on the streets, and they're here and we're giving them medical care. Back to work.
This day and age, we're seeing not just adults with high blood pressure and high cholesterol and diabetes and obesity, but it's a growing problem in children. What do you think we should do to help reduce this problem? Well, doctors in Washington have completed a record-setting series of kidney swap surgeries. The 26 operations provided kidneys to 13 people. It's part of an effort to give transplants to people who too often never qualify for one. Anita Brickman reports.
Healthcare reform is heating up here in Northwest Arkansas. We'll hear what some of our fellow Americans have to say.
Dr. Gullett, thank you so much for having us and giving us a tour of your new facility. Tell us, what does AHEC stand for and what is the mission of AHEC throughout the state of Arkansas? This looks like the clinic area, so much more spacious than when I was in clinic as a resident last year. Tell us about this area, what goes on here.
Well, as you can see, this is our new improved.
If you're heading out in the sun for a little fun, don't forget to lotion up. You don't want to get a painful sunburn. We get more on this medical condition from the pharmacy.
We do everything from, seeing pregnant women, prenatal care, offering prenatal care. We work in the emergency room. We are in clinic. We work also in a nursing home as well. So we just get a variety of all sorts of different patients. It requires a lot of sacrifice, a lot of studying, a lot of hours in and out of the hospital, but it's what you do that makes you happy, that keeps you going.
For most of us, summer means fun in the sun. The kids are out of school, adults are on vacation, and it's time for outdoor activities like riding bikes, motorcycles, and ATVs. But it's also the time of year we are most likely to be injured. And across the United States, emergency care facilities see nearly a 20% jump in traffic during the summer months. Knowing is half the battle.
preparation and prevention is the other half.
Researchers say a drug which has been approved outside the U.S. for weight loss may also help slow the progression of coronary artery disease, a disease that is often very difficult to treat. Here's more from Jennifer Mitchell.
The mitral valve controls blood flow on the left side of the heart. It acts as a one-way gate, letting blood flow from the upper heart chamber to the lower chamber.
A sellout crowd of more than 1,000 women is expected to attend the Speaking of Women's Health event at the Hammond Center in Rogers on August 9th. The conference highlights the importance of educating women to make informed decisions about their health, well-being, and personal safety.
Did you know that Parkinson's disease affects about 1 million people here in the United States? It's a disease that can eventually rob an individual of his or her independence by diminishing their physical and/or mental condition.
And from climbing for a worthy cause to whining for one, a benefit for the Northwest Arkansas Free Health Center will be held Wednesday evening at 6 p.m. at the Urban Table Bar and Grill on the Fayetteville Square.
Child deaths from swine flu are rising in the United States, with 19 flu-related deaths reported in the last week alone. 5% of these cases will be in women under the age of 40. Health experts agree the best way to overcome the disease is to catch it in its earliest stages. However, that can be more difficult because breast tissue is more dense in younger women, and for unknown reasons, some breast cancers can be more aggressive in these patients. Exercise used to be considered potentially dangerous for people with heart failure. However, 2 reports from a large study in JAMA confirm the safety and medical benefits of supervised exercise and show how it can improve a patient's quality of life. Haley Weldon explains.
Well, thanks for being with us for Arkansas's only weekly medical report. If you have any health news or story ideas that you'd like to see on our program, we'd like to hear from you. Visit our website, jonestv.org, and drop us a line. Join us next time here on Jones Television, Channel 22. I'm Dr. Janette Nesheiwat.